The town of Berlin. Country charm at the center of Connecticut.
Meeting to order, our December 6, 2000 meeting, and start with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Roll call.
Councilor Campanelli?
Here.
Councilor Evans?
Here.
Mayor Kaczynski?
Here.
Councilor Leddy?
Here.
Councilor Payne-Nessa?
Here.
Councilor Rochette? Councilor Rosso?
Here.
Mayor, you have a quorum.
Thank you. Thank you. Okay, now we have our audience of citizens. If there's anyone here that wants to speak on any topic, now is your time. Other than if there's people to speak on something that's on the agenda, then you can wait to then, or you can speak now, I guess, right? Either way. You can probably wait for the topic to come up, so. If there's any topic that's not on the agenda, anybody want to speak? No brave souls tonight? Okay, that's fine. All right, we'll close that part of the meeting and we'll go to our consent agenda.
Mayor, I move to consider consent agenda item number 5 separately.
Okay, so number 5. All right, here's number 5. Okay, so is there a second on that?
Second.
All those in favor?
Aye.
Okay, so we'll move, that'll be first on the new business there. So we have a motion on the consent agenda other than 5.
Okay, I'll make a motion to accept items 1, 2, 3, 4, and 6 in the consent agenda, to accept those as written.
Okay, second on that?
Second.
All those in favor?
Aye.
Opposed? Motion carries. Thank you. So we will take old item 5. I guess it'd be
Just say it's item 5.
item
It's on the
5. All right,
consent.
item 5 from the consent agenda. Dave, you have a question on that?
Yeah. The question I have on that is, it looks like we made a mistake as a town permitting authority, and wanted to see how that is being remedied going forward.
All right.
You mean internally? I know that there was
Yeah.
a mistake that the zoning enforcement officer caught before the actual work was done, so she had stopped it before it actually went forward. They would have been having to go before the zoning board of appeals anyway, but because of the delay that it was caused on the part of the building department, it was felt that this was the fair way to treat the residents, that they understand that a portion of the fee is not able to be waived because we have to pay the state the $60.
Yeah, they'd indicated it was an oversight in the town's permit approval process, so I wondered if that has been remedied for going forward, if there's something that we need to do operationally, procedurally.
This was a fairly new assistant building official. He had been on the job a very little time, and I think it was a matter of training. He is no longer with us. He is, not because of that, but he has moved on to a full-time position in another town. Hopefully, we'll do more training with the new person that comes in, but it I think, was a matter of some of the newness wasn't known by him as to the correct way to route the permits.
Okay. Yeah, I'm supportive of the waiving and returning funds, or what we need to do here, but I just wanted to make sure that we got our ducks in a row going forward, and if that is going to impact how we're going to staff the department going forward, that might be part of our upcoming budget discussions. So.
Yes. Helen? Yeah. Our town planner can maybe answer some more.
The town manager is correct, and it was a mistake, and unfortunately, people do make mistakes, but we are trying to improve our building department process by not making every single permit go through the zoning department. And he unfortunately was a little overzealous and didn't understand that zoning runs vertically as well as horizontally. So when the addition came in, he didn't route it properly. It's a mistake that I can understand he made, but it won't, I hope this will never happen again, but we're really trying to streamline things, and sometimes these things happen. It was very unfortunate. I was very sorry that it happened, but we are trying, to have an officer that is sort of a hybrid zoning and zoning and building enforcement. And so he's learning, or he was learning, and so will the next person. And I'm sorry that I am very sorry it happened, but it is a way actually to improve our department's efficiency and return rate on the permits.
Okay. Thank you.
All right,
Thanks.
thank you.
Okay, we have a,
Okay, move to approve the request by David and Anna Prizzuti to waive the zoning board of appeals application fee for $150.
second on that?
Second?
All those in favor?
Aye.
Opposed? Motion carries. Thank you. Okay, new business, topic number 1 of a presentation.
It's the annual presentation by the Central Connecticut Health District.
Thanks. Yeah, you know what? I wonder if we should do
You could,
two. You want
whatever you
to
want
do
to do.
two? You want to move this last? Yeah, because how long, Charlie, is your?
It's not very long.
No. All right. Well, you know what? Maybe the young people in the audience can learn something. So we'll have you do your presentation, then we'll do the bike race.
I'd appreciate that.
Yeah. There you go. All right.
Okay.
Okay.
And public health appreciates that too. Which
Yep.
one of these is on? I think this
They're
one.
both on, I think.
Oh, yeah, right.
We have to go down?
Yeah, right. You got a slideshow, right?
Both of them are on.
We got a dog and pony show?
No, we don't have a dog and pony show.
No
Un-
slides?
We have slides.
Yeah, there's
Yes.
slides. Okay.
So we can,
Oh, that's the definition of dog and pony, okay. My name is Pat Checo. I am not Judy Sartucci, the chairman of the board, who unfortunately could not be with us this evening, but I am the vice chairman of the board. We are delighted to be here, and thank you for offering an opportunity to again meet with you to make a presentation on what we have done for the residents of our district and some plans for where we're going in the future. I'd like to take 1 second to present the other representatives from Berlin, if you don't know them. Carolyn Wysocki, who you may know for many reasons. And Carolyn is a member of the board and also the chairman of the governance committee for the district. Also Ray Jarema, who you know for many reasons as well. And Ray is a member of the Human Resources Committee, and I serve as the chairman of the Finance Committee. I share that with you so that you are aware that your representatives are very involved in what goes on in the district, and I would hope that would make you feel better about the commitment. So I'd like to turn this over to our Director of Health, Charlie Brown. We are incredibly fortunate to have Charlie. He's finished his, first or second full year?
It's going into year 3 now.
Right, and I think hopefully that many of you have noticed the changes and the improvements and the difference in what's going on in the district, and we are very thankful to have him and very lucky to have him. So thank you again for having us here, and we're happy to answer any questions anyone has. And for you young people, I hope maybe you'll learn what public health does besides inspect restaurants, and maybe potentially have some interest.
Thanks, Pat. Let me go ahead and set up the presentation. The last 2 years, we had problems with the technology. I
Not this
swore
time.
we're not
We are not
going
going
to have problems this year. So we'll see. Now let's make sure it comes up. Okay, so. Simsalabim. Ha.
Ta-da!
Okay. Sorry.
Okay, now all I have to do is...
Just get rid of that. Okay. So you're gonna go
Yeah.
down. So
All
you're
right.
gonna-
Am I in your way? I don't take it.
It's a process, y'all. Well, thank y'all for having me. My name is Charlie Brown, and I'm happy to be here for the third year to be able to present on our annual update to our member towns. So Pat, go ahead and move it forward. Down arrow. So our basic premise and the three main things that we do in public health are preventing, promoting, and protecting. So that's the main overall title for the presentation, and you'll see a lot of prevention in this particular presentation. Go ahead, Pat. So some general information about CCHD. We are the local health department for the towns of Berlin, Newington, Rocky Hill, and Weathersfield, and we serve about a population of combined about 98,000 people. We were founded in 1996. We just celebrated our 20th anniversary, and we had our 20th anniversary celebration actually here in Berlin last month, and I appreciated the mayor showing up and being able to allow us to, or help us to celebrate that. Picture you see here is Senator Terry Giarratana, who actually presented us with a proclamation from the state of Connecticut legislature recognizing our 20 years of public health service. Okay. We are one of 20 regional public health departments in Connecticut. So all of the blue spaces that you see up there are towns that are actually covered by regional local health departments. We are number 2, which is almost smack dab in the middle, which is why we're called the Central Connecticut Health District. General information on us: we have 12 employees, 9 full-time, 3 part-time. Currently we're working out of 5 separate offices, one in each of one of the town halls, and then we have an office in the Newington Senior Center. We have a lot of volunteers that actually help us to do the things that we do, both professional and lay volunteers. And we have an oversight, as Pat said, by a 14-member board of health, and the representation, you can see the breakdown there. Berlin does have 3 representatives, and you're very lucky to have the people that you do represent you. There's a wealth of experience and knowledge in public health within those 3 people, and I count on them immensely as we move forward. Okay. Basic numbers. Last year, the 2015-2016 fiscal year, our total revenue was just a little over $1 million. Most of that money, or a good portion of that money, comes from town contributions. We get $5.11 per person per year to do public health services from each of the towns that are members of our district. Aside from that, we get revenue from programs like flu clinics and providing flu shots, and other programs that we actually put on. We have grants from the state for things like emergency preparedness, block grant activities, and we actually get money to do asthma grant and asthma prevention. And then we get a little bit of money from interest that we have for our reserves. Our expenditures, a little bit over $1 million back in last fiscal year, and like any service agency, the majority of the money that we actually spend goes towards salaries and benefits. We don't produce widgets. What we do is we do services, so we have our money spent in the people that actually do that. Other portions of our expenditures are for professional contracts and other things. Program and operating expenses take a good chunk of that, and then the other wraps up around $16,000. Okay. For a little bit of education purposes, public health and healthcare are similar, but they're different. So when people say health, a lot of times people think healthcare. And what we do in public health is a little bit different. So in healthcare, their primary focus is on the individual. When you get sick, you go to the doctor's office. For public health, we look at the population as a whole as our patient. So we really take that broader perspective as we look at health. In healthcare, when you have an intervention, you would think about diagnosis and treatment of that individual illness. Public health, we look at the 3 core functions of assessment, policy development, and insurance to be able to diagnose and then treat what the issues are with populations. Process that you use in healthcare, they really manage patient care. Where in public health, we look at systems management, how we can deal with the environment as a whole, how we can help to manage human behavior. The outcomes, at the end of the process, we return the individual back to health in a healthcare scenario. In public health, we really try to focus on healthy communities and making the communities healthier as it goes on. So let's use influenza as an example of this. So in a healthcare response, you screen for risk for influenza, you teach people how to prevent getting it, and you give them an annual flu shot. How many people in here have gotten their annual flu shot? Oh, come on. Okay, so if you happen to get influenza, we're going to treat you with Tamiflu or any other meds when you get infected if you're in a healthcare scenario. We're also going to treat any related conditions that may be secondary to that, so pneumonia, things along those lines. And then as the last part of this, to close the loop, we're going to report that disease to the state public health department so that they can do those number of counties and find out what the burden of influenza is. Public health response, we look at public information campaigns. So trying to make sure that people have the knowledge to be able to prevent getting ill in the first place. We also monitor and track the seasonal occurrence of flu. So what's going on out there. And if we find that there's flu and we know when that's going to happen, we start to do targeted or mass vaccination clinics so that people can get that flu shot. And so far we've done, let's see, tomorrow will be our 10th flu clinic for this season. And then we also look at this to promote policies, like making sure that employers require healthcare vaccinations for their healthcare workers so that they can protect themselves as a critical resource, but also protect the patients that come to them to be served. Okay? Main purposes of a public health agency, there's about 6 of them, and we'll go through these in a little bit of detail. But it really comes down to that 3P kind of mentality, that prevent, promote, protect mindset. Okay? So we'll move forward and we'll jump right into this. So preventing epidemics and the spread of disease. To start off, once again, back with influenza. In those 10 mass vaccination clinics that we've done, we've given over 2,000 flu shots in this season across our 4 towns. And the average time that it takes for somebody to actually get a flu shot when they come to our clinic, when they walk in the door to when they're walking out with their arm with a Band-Aid on it, is about under 3 minutes. And we use these clinics as an opportunity to test our preparedness plans. We spend a lot of time trying to plan for things like pandemics. And those plans get an opportunity to be tested every year. So we use our influenza campaigns to do that. Another thing that we do to prevent epidemics and the spread of disease is to follow up on disease. So there are certain reportable diseases in the state of Connecticut, and the list changes a little bit every year based upon the epidemiology. But we actually follow up on those diseases to make sure that we can help to identify where the causes are, we can see if there's any trends, we can look to see if there's a potential intervention that we can do to stop that from happening. One of the main things that we've been looking at lately is the rise in hepatitis C. So we see hepatitis C rates starting to go up in all of our 4 towns. And that's an indicator of a lot of different things. One thing it could be is intravenous drug use. So how hepatitis C travels is by bloodborne pathogen. So it has to be blood. So we're looking at those rates and trying to figure out what we're going to do here in the future to address them. Okay? One of the things how many people heard of Zika in the last year? If you didn't, you were probably under a rock. Luckily, Zika, we don't have the type of mosquitoes here in Connecticut that carry Zika. Unfortunately, we do have a lot of people that like to travel and to places that do have Zika. So we do have cases of Zika in people that live within our district. People in our district have actually contracted the disease. And we work with the state health department to be able to get them information on what they can do to limit the impact of that disease. West Nile virus, we had a very good season for West Nile virus. We only had a couple of mosquitoes that were tested positive for West Nile over the last season, and luckily we didn't have any human cases this year other than one down in Greenwich. Probably not going to last. So everything that you can do to help to alleviate the environment for mosquitoes, where they breed, those types of things, are things that we can do to help limit and prevent that spread of disease. Eastern equine encephalitis is also something that we look at, and usually that's around places where horses are. So we do have some of those places within our district, so we try to get information out about that. We do monitor that disease as well. Protecting against environmental threats. Across our district, we actually have done over 2,000 different inspections. In Berlin alone, we have 104 different food service establishments that we actually inspect every year on a different basis, either one time a year up to 4 times a year. And we do a lot of time, and our environmental health staff does a great job in making sure that you're safe when you actually walk into those places to eat food, to be able to enjoy a pull. If you go to the salon, we're inspecting those as well to make sure that they're safe. Okay. Additionally, we respond to a lot of complaints. In fiscal year 15-16, we responded to 170 different complaints, and they ranged from trash to hoarding. And we see a lot more cases of hoarding or housing complaints every year. And public health has a particular concern here because they may actually get to the point to where they affect the public's health as a whole. So we have to investigate these complaints. We work with social services within each of our towns, and we really try to look at the big picture. How can we improve the health of the individuals and the communities that we serve? Okay. Additionally, we also have the Putting on Airs program. We serve a region of about probably 16, 18 communities, Region 2. And what this program is we actually conduct home visits for for children that have a risk of asthma. And they may have critical asthma triggers, things of that nature. So we work as a team with asthma health educators and environmental health professionals to go into their homes to educate them on asthma and their medications, but also to do an assessment of where they live. Because asthma triggers like mold, insects, dust, can really impact a child's health. So what we do is we work with the homeowners, the landlords, to help to alleviate these types of triggers so that the children can help to manage their asthma much better. Okay. We've done a lot of radon kit distributions over the years. We continue to get that information out there. Radon is a contributor for lung cancer, and we do have kits that we actually do distribute so that people, not just new in their homes, but if they do buy a new home, they can test it to make sure that if they need to mitigate their environment inside their house, they know what they're dealing with. Lead poisoning prevention is also something we've been focusing on. And last year, we sent out about 1,800 letters across our district to reach out to rental properties that were built before 1978. Because 1978 is a magic year. And that was the year that they decided to not have lead-based paint. Okay? So if you have housing that was built before 1978, there is a potential for lead paint to be there. So we did a lot of educational outreach for people that are living in those conditions, in those properties, just so that they know what the risks are, so that they know how to protect themselves. But it's not just peeling paint. In some of the cases that we followed up on, where we have to follow up on lead-poisoned children, where the lead levels in their blood are above 0.5 milliliters, millitech?
It's 5.
5? Okay. That's why I have Pat here. But we actually follow up on that cases. And in some of those cases, it's not the lead paint that's the issue. It's things like pressure cookers that were brought from overseas that may have lead in their composition. We've seen toys. We've seen amulets that from another country that actually had lead and the child was actually being poisoned from that. So we have the opportunity to be able to do an investigation, to actually do testing on some of the surfaces and some of the materials that the children come in contact with to try to find that source of lead so that the child can actually be treated and not continue to be poisoned. Preventing injuries is a big thing. How many people are riding their bikes? How did I know I was going to get the hands raised over here? How many of you wear a helmet? That's what I'm talking about. So we actually do provide helmets. We provide helmets for $10, which is a heck of a deal. So if you're looking for Christmas presents, helmets at the health district are a heck of a way to get them. But there's a more important reason, just to make sure that people are protected, and children specifically, as they're out there doing the right thing and engaging in those healthy behaviors. And we try to use Facebook to remind people about those healthy behaviors and some of the risks that they may come into contact. So when you see things like beef recalls, things like that, we try to push that out through a variety of communication methods so that people are aware of what's going on and how they can protect themselves. We have worked a lot, and somebody sees their picture up there. I should have told you your picture was up there, Denise. So last year, we've had a walking competition for quite a few years, but in the past, it's really been between town employees and town government. And it really started between Berlin and Rocky Hill. And, you know, we expanded it in the first year that I was here to cover all 4 towns within our district. So all of the government employees got together, and they were all walking in the month of April trying to beat each other. Last year, we opened it up to the public for the first time to let all the citizens of our district to be able to compete against each other. And Berlin, once again, came through as a competition winner. And if you look downstairs, I think it's behind a board, but it's in the rotunda.
You don't want anybody to steal it.
But you'll see the high stepper trophy that Denise is carrying there and was able to be presented with at the end of our competition. It's kind of funny, it's a little cheesy to be able to say the high stepper trophy, but the reasons behind it are critical. The more that we can get out and move and be healthy as individuals, the less likely we're going to be dealing with chronic diseases and things of that nature. So we use this opportunity to help to encourage healthy behaviors. We've been doing, since the end of the competition, we've been doing monthly walks. And just this past Saturday, we had a walk here in Kensington to be able to, had about 15 people with our Path to Health that walked with a naturopathic physician, learning a little bit, but also getting out there and actually walking. Okay. In addition to that, we have revised our Living Healthy in the District guide, and this has a variety of information about ways that you can get healthier within the district. So things like healthy shopping, farmers markets, where all the trails are within our district. In addition to that, we have begun to do training sessions. So here last month, we actually did our holiday food safety training in all 4 towns, where we actually brought people in, taught them about how to safely handle food for groups, what to do to be able to save it afterwards, and really have started to work that out. And this is something that we're going to continue to expand. That education, that knowledge is power on how to be healthy and how to stay healthy is one of the key functions that we can do. Responding to disasters and assisting the communities in recovery, we work a lot for emergency preparedness. The mass vaccination clinics is one way that we do it, but we also test our plans through exercises. And this past April, we had our emergency preparedness planning group that did a statewide exercise on medical countermeasure dispensing. So if we had to be able to give out drugs to all the members of our community, how do we plan to do that? So we had an actual distribution that came down from the federal government through the state distribution center, and we had our allocation, and we tested our plan on how we would distribute that out.
And Charlie, before you move on, you might want to share that we're kind of on standby for New Britain.
Yeah. Oh, yeah. So one of the things that we do is we work regionally with Capital Region Council of Governments and CEREPSI, which is their emergency planning committee. And right now, this afternoon, we had a train derailment. How many people heard about that around 3:30? Well, the region stood up to be able to support New Britain. to be able to say, what can we do to be able to help if you need it? So I have a phone in my pocket. It stays by my bed 24/7, just in case we get called up so that we can provide resources to help our neighbors. And we have the ability to draw those resources in at need as well. Okay, thanks, Pat. Assuring the quality and accessibility of health services. We do a lot of senior dental cleanings. These are free screenings that we cover through a combination of funding from the district and funding from the North Central Area Agency of Aging. I always screw that up. Last year we saw 143 clients. And that free dental screenings for the elderly is an important thing because oral health is kind of the pathway to good health. And when we start to see that decline, especially among the elderly, you could see health deteriorate from there. So this is a program that we're very happy to provide, a service that we're very happy to provide, and we look to continue to do this in the future. So speaking of the future, as I mentioned, we have about 5 different offices, and last year we were here, we kind of broached the subject of, we've been looking at centralizing our office space. And we've continued over the last year to look at the potential to do that. And really how we would do that and work with our towns to be able to make sure that we're doing the right thing with that. We're continuing to look at that. And it is something that we may end up doing in the future. National Public Health Accreditation is something that we strive for. Currently it's a voluntary process, and we really look at it as a way to improve the quality of the way of doing the things that we do. We're also looking at revising our administrative and health policies. Specifically right now, we're in the process of revising our sanitary code. And we will be having public discussion about that because it does impact our regulated community quite big. And then the big elephant in the room, state regionalization of public health. Connecticut Department of Public Health has said they're going to be putting a proposal forward in the 2017 state legislature to change that map with all the blue that you saw into something that resembles much more like a county system that you'd see in much of the country. There's still a lot of conversation to be had about that because there's still a lot of conversation to be had about that. I, as a health district director, am a proponent of regional work. I believe that regions can work to help serve things efficiently and effectively. But that work needs to be from the bottom up, to where the towns and the people that are involved in the regions have a say in what goes on and how it happens. So that's one of the reasons why our district has been in existence for 20 years. So there's going to be a lot of discussion about this. There's been a lot in the media about it as well. But it's very much in the formative stages at this point. So my last 2 words are thank you. Thank you for being part of the district, for being engaged with us, and for your continued support. If you're looking for information about us, this is our website. I encourage you to follow us on Facebook and to engage us in conversation about what your health needs are as a community. And I stand ready to answer any questions. Nothing. Awesome.
I have some questions.
Okay, we'll break down the presentation and then we'll go from there. Thank you very much. Thanks, Pat.
Now I gotta get the chairs all over the place.
Charlie, can you send me a copy of?
I will. When I'll reset, I'll move this out of the way.
How you doing?
I'm hanging in there, usually talking faster than a Southerner generally does.
I'll try and be quick. I'm glad you brought up the regionalization because I did print out the CCM
Yep.
story on that, and you know, you had a revenue number up there of 499,000, and you charge $5.11. So I guess that's based on the population of the town.
Yeah.
So if we're looking at $102,000 per this town, according to this proposal, it could cost us anywhere from 0.5% to 1.5% of our budget. So for us, we have to look at that because we can be going to $450,000 a year to 1.2 million.
Right.
And that could destroy our budget.
And I wholeheartedly agree with you on that.
All of the health departments agree with you.
Yeah.
And, you know, as a district, that's one of the things that we're very conscious of.
Okay.
As we come in every year with our budget lines for per capita, is what's going on with the municipalities. As I said, I think regional health districts work, but they work best when they have that interaction with the towns, and there's the ability to set those types of rates at levels that they need to be set. Do I think public health needs more resources? Yes. I'll say that very emphatically. But at the same time, you can't squeeze municipalities to be able to get that from the top down and from the bottom up. Pat?
Charlie, could I just add something to that? I think it's really important for our local governments to understand that this came out of the Commissioner of Health, period. There has been no interaction with any of the local health departments, any of the local municipalities, and certainly as soon as many of us heard about it, we went to see our friends at CCM.
Yes.
To share with them. So we are all equally opposed to this plan that was done in a vacuum and has really not looked at the realities. That is not to say that there's not a discussion to be had for regionalization. If we start looking at each municipality, if each of you had your own town, and you were paying for director of health, for your overhead, for everything else, it would cost you more than it costs to belong to a district, and hopefully we provide the services more efficiently.
Yes. And I think that one of the things that may come out of this particular proposal is the conversation about really what public health services look like. And I think that that's a conversation that as Connecticut, we really need to have. Can we improve the way that we do business in public health? Absolutely. I think that all governmental services can improve. But it needs to be an open conversation. And that's what I'm looking forward to at this point, is they've kind of put it out there at the commissioner level to say, okay, this is something that needs to be changed. Fine, let's talk about this in a rational way, to talk about what isn't working. And then to be able to say, how can we work together to improve this? So that's my perspective on this.
Okay.
And we are going to have some conversation. The Commissioner of Public Health has some meetings coming up here in the next week or so with local health directors and a variety of people around the state. They've invited local officials as well. And I encourage you to participate in that conversation.
Thank you for the information.
Any other questions?
Yeah, just one other question.
Yes, sir.
You talked about potential centralization of offices and so forth. In your considerations of that, is that primarily in service of your customers, or is that also in looking to find a more cost-effective location to work from?
Short answer is yes.
Okay, thank you.
Both. And we've been looking at centralization, and it was a charge when I came here a little over 2 years ago, was to look at the efficiencies of the operation and how we can actually do this better. Centralization is one of the things that we looked at. It's very difficult as a manager to manage in, the people that I have over 4 different towns. So being able to consolidate and bring my people together would provide a variety of improvements. The ability to work as a team, to be able to use resources a little bit more efficiently, to be able to support them administratively much better. I have some towns where I have just a sanitarian. So the administrative tasks and things that are by nature, come with the job, they're having to handle kind of on their own, which limits their time out in the field. This is something that we've been talking with town managers about, we've been talking internally about, and we're still going to bat it about a little bit. The final decision on this hasn't been made, but we're really looking at centralization as a way to be able to serve our towns much better, to be able to use our resources much more efficiently.
Thank you.
Yes, sir.
With this consolidation, the inspectors that are going to be coming out. will be
I'm
staffed-
sorry, I need people on the mic. You're gonna have to come up here.
They got to get it on transcript or else it's hard to capture later.
Liam Mitchell, 1005 Kensington Road. My question is, with the consolidation, these inspectors are not going to be in the same perspective when they're in their towns, and the same inspector may not come back to the original restaurant that he is familiar with, and an ongoing, when these inspectors go into a restaurant or they do their inspections, they have a program that they set up. Some people are farther ahead, some people aren't. And they work with them in making sure that they, every time they come in, they nudge them along in the code book to bringing them up more, finding out the latest things that are going on, maybe the latest thing that the health department is concerned about, I'll say. You know, hand wash sinks was 1 year, where the soap dispensers became the next year, and it sends a flurry for these people, because some of them don't have the room, and they work with them, and they come up with ideas, and with this consolidation, a lot of that is going to be very difficult, because these inspectors are not going to have a flow with the individuals like they would if they were in the town.
And thank you for that. And we have looked at the pros and the cons of this, and we'll continue to do so. One of the things that we see is that sometimes having the same inspector come in all the time can be problematic as well, because you tend to ignore things that you've seen over and over again. So being able to change that periodically and change the inspector and provide that fresh set of eyes gives the opportunity for us to make sure that that restaurant is up to snuff across the board. Really what we're looking at is making sure not to switch a different inspector every time something happens, but to provide some consistency and the ability to use resources where we need to. As you mentioned, you know, some restaurants may have bigger problems than others do. And, you know, in that respect, we may have to work as a team to be able to help bring them up faster. And that's what we look at, is how we can draw upon all the expertise of our staff to be able to do our jobs much more effectively. Okay.
Great. Any other questions for Charlie? No? Okay, great. Thank you, Charlie.
very much.
Thanks a lot. Thanks for keeping us safe, keeping the Zika away, and whatever else we can do.
Well, just remember,
Get your
protect
flu
yourself, long sleeves, repellent, please.
We'll take that advice.
Thank you all.
Thanks a lot. Okay. We are now on to our topic 2. And for those of you that listen that are still in school, it's a quiz on the health district stuff tomorrow, all right, just so you know. So I hope you paid attention. All right, so what do we got? Oh, sorry. What do we got, Denise, number 2?
Oh, okay. The Connecticut Cycling Advancement Program has been working with the Berlin High School Riding Redcoat Cycling Club to put on a one-day event on April 29th, 2017, the rain date being May 20th. This is part of a capstone project of some young people, 5 seniors at Berlin High School. Capstone projects are things that are required for the graduation. These seniors are here this evening: Morgan Hamilton, Charisse Thompson, Alex Glabow, Jerry Wood, and Rocky Trin. All 5 have been very active in the cycling club for a number of years. This Connecticut Cycling Advancement Program is a 501c3 nonprofit organization. They would like to put on this race. There are some details. It would be held basically at Hatchery Brook Conservation Area. They would be taking care of the trails prior to the race, taking care of the trails after the race. They'd provide registration services, monitors. It would go from 8:30 to 2:30, and the preparation and cleanup would run from just about all day. There are some logistical questions that the Conservation Commission had from their last meeting this was originally proposed to them on their November 8th meeting. Staff, Helen has phrased the agenda item to seek council's approval for the event and parking on town land, but there is a request by the Conservation Commission that they get this back for a final review and working with the group on logistics and comments that may be necessary as the event comes closer. And we do have all of the people here, and Mr. Arnold, everyone is here this evening and open for questions and maybe would like to say a few words.
Yeah, whatever you guys want to, so tonight, we're just going to, we'll listen, and we appreciate the information and your attendance, and then we'll send it back to the Conservation Commission to finish looking at it before it comes back to us, so.
Thank you, Mr. Mayor and members of the Town Council. My name is Karen Franzen, and I represent Connecticut Cycling Advancement Program. I work closely with these guys, and I am actually going to turn this over to Morgan and let him give the presentation.
Can you just state your name for the record?
Okay, I'm Morgan Hamilton, senior in high school, been in the bike club and mountain bike race team all 4 years. And basically, what we're trying to do is, for us 5 seniors, for our capstone project, we wanted to host the race at Bicentennial Park in the Hatchery Brook Reserve area. And we presented this to the Conservation Committee, and their main concern was that parking on town property was not okay because it could destroy the open area. So they wanted us to get back to them with different ideas for parking, and we decided that Linden Street, which is across from the parking lot, an area in which we'd be racing, would be best. We contacted the police department, Officer Gould, I believe, the head of traffic. He said that it would be okay for us to park on one side of Linden Street for the whole day and close off the other side for no parking. The overflow parking, if anything, if we needed any more parking, there's gravel parking lots along Chairman Highway, different parking lots that are used for the Bicentennial Park that we could send overflow cars to. Yeah, there's also the other road that branches off of Linden, Summit Wood. There could be a good bit of cars parked up in there as well.
Great. I just have a question. Do you know how many participants you would expect? Just out of curiosity.
Around about 100 at a time.
Okay, so they're coming at different. They
Yeah.
start at different times.
There's
right?
4 different
I see
races
that.
at 4 different times, and as the people finish racing, they pack up and leave. So it
Oh,
wouldn't be
okay.
everybody at once; it'd
I
be at
gotcha.
different times.
Okay, good. Great. Yeah.
I just want to say, I think this is a really great idea that you guys have come up with for your capstone. I think that's really wonderful. Found a way to, make something great for everybody here while learning. So that's awesome. Good job, guys.
Thanks.
Thanks. Got more info or?
Yeah, a little bit. Jim Arnold, I'm a teacher at the high school. I'm head of the Berlin High mountain bike race team and the bike club. A lot of other information. Basically, we really want to respect what the Conservation Commission has asked of us. We were originally thinking, hey, look at that great big field right there at Bicentennial Park where everyone walks their dogs. Plenty of space to park everything, and obviously there is no way are we going to go in there. So we went back and we regrouped and we were thinking about it. We knew that would be problematic, so we went to let's look at it and let's not even use Bicentennial in the entire equation, so that there is no issue with riding the bike, so there won't be any conflicts whatsoever. The places that we're going to be is, if you're familiar with the old Girl Scout camp in the back behind Bicentennial, and that area and back to Orchard Road is where we're going to be. The parking lot where the gardens are, the community gardens, That parking lot will be used basically by the people that are setting up, the people that are coming with all the equipment and everything else, and then whatever handicap parking that is necessary will be also available right there, so they can be right there. And when we talked to Officer Gold, he already sent this by his police chief. I'm sorry, I don't know his name, and when he got back to me, he said that, yeah, it feels like it's going to be a go. We'll put no parking signs on one side of the street. The other side is going to be the availability for everyone to park up. And there's like a little, at the top, there's like a cul-de-sac that's unoccupied, probably like 15 cars could be up there. So it feels like this is a really good solution for the main issue, which was parking for us. The next issue that they had come up to us with the conservation, they said, well, what about the rain? And generally, there's never a rain date for a race. It's usually rain or shine, and off you go. And we came up, there's a lot of work on Karen Franz's part, came up with a rain date. So it's very unusual, so that's kind of nice, but it's us being as flexible and working as hard as we possibly can to make sure and try to take every possible precaution that we can have the best race possible while conserving the land of the town. And we also are absolutely going to be volunteering our time afterwards. So there's some areas that might get rutted a little bit. We're going to be out there with our rakes and shovels, and we're going to be putting them back the way that we found them. So when you're out there hiking, walking, biking, whatever you're doing, you're not going to know that we're even there.
Great, you can fix some other stuff while you're back there, right? Whatever else needs to be fixed. Nah, just kidding.
Absolutely, absolutely.
Yeah.
Thank you.
Yeah,
That's great.
absolutely.
Yeah, that's really great.
Excellent.
That's great.
May I
Any?
just,
Yeah, go ahead. Yeah.
Just a question for the team there. Have you approached any of the residents that live on those particular streets to see, and maybe one of you happen to live on that street? That's always a positive thing. You can talk to your own neighbors, but have you thought about doing that?
We've thought about it. We haven't approached any of the people that live on the street. We
Okay.
figured that we'd get permission from the police first, and that's all we've done to this point. We have been thinking about going up and down the street door to door, asking if they'd support the event.
Okay.
So
One of the other things driving that decision was that it's basically a public road. So, I mean, if someone's having a big birthday party on that road, it's kind of the same inconvenience. Like I said, we're taking the step further of making sure no one's parking on one side of the road and a police officer there to make sure it happens.
It's always great to get the public support where you're going to be impacting the community, and if I lived on that road and I understood what was going on ahead of time, hey, I would be supportive of that. But so there's others that may not be, but it's still a public road, and giving them the courtesy of knowing what's coming up is always a good positive thing for the community.
On top of our riding up and going door to door after this, we will also have signs put up. I don't know how long out, a month out, a week out? A week out. And so if we're not able to reach somebody, or the paper that we leave in their door, they don't get, there'll be signs up and they'll be like, what's going on? Why are these signs here? Hopefully they'll get the information in some way.
Excellent.
Great.
That's great.
Okay.
Great. So, great project. Sounds like it'll be a lot of fun in the spring for you guys. Great capstone project. So we're not I know it's got to go back to the Conservation Commission, right? They're gonna take care of it.
That's what we were told. We were just, I don't really understand how it all works.
Yeah, that's all right.
It feels like it's favorable here, and it feels
Yes.
like it's favorable there. We've solved
Yes.
the issue of parking.
Yes.
When do we actually get the sign of,
Well-
okay, you can actually do this
Yeah,
thing?
I think what will happen is, from what I understand, is going back to the Conservation Commission wants to just review this parking plan and whatever other questions they may have. I think probably restoration of the trails, from what I understand. So, once they're done with it, they'll refer it back to the council. Either if it's not our next meeting in December, maybe the first meeting in January, or as soon as they get done with it. So it'll come back to us in plenty of time where we could make a motion to.
Do we generally come back for that one also?
Yeah, I mean, I think
Good idea.
A good idea for the boys to come back and see their government in action, probably. So, so that's what'll happen. So back to the Conservation Commission. I would attend whatever meetings they have on your event, obviously, and see what they want to do and what questions they have. And then when they're happy with it and the police department's happy with it, they'll come back to us.
Okay.
Yeah.
Great, thank you so much.
Yeah, great event. Thanks.
you.
Thanks for
Thank
coming.
We'd also like to
Appreciate it.
publicly thank Helen. She's basically really been holding our hand, guiding us through the whole process. So thanks, Helen, for all your efforts.
Great.
Thank you.
Look forward to the race in April, or May, hopefully April.
Do you ride?
Yeah, no, not anymore. On the road.
Okay.
Guided trail wouldn't be good, yeah.
A little bit.
Yeah,
Good.
thanks. Okay. What do we got?
Want a motion on that?
I don't, do we need a motion? Okay,
Yes.
so motion,
Move to send the CCAP's request for a bike race at Hatchery Brook Conservation Area, along with associated parking, to Conservation Commission and other departments as needed for any comments before action is taken.
second on that?
Second.
All those in favor?
Aye.
Aye. All right, so moved, thank you. Number three.
4.
Three.
Oh.
Three?
3 on this agenda, but didn't we add something?
Called it 5.
No,
Oh,
we called it five, yeah, we
Okay.
called it five.
This
Ri-
is,
original
it's,
item.
Five before three, I don't know.
it's time for the early order program for the golf course. Unfortunately, today was the last day that the golf course was open this season because of the upcoming coldness and the snow that's coming tomorrow and things. But we're now getting ready for the 2017 season, and each year John comes and there are certain companies that do a portion of their products as agency products. The price is the same no matter who you buy these from, but they also encourage the early order of these products so that Jonathan will take advantage of some of the discounts or coupons or whatever they call it, and he's here to explain the program once again.
Good evening. Again, with the early order program, we've been doing this for approximately 10 years now. And most of the golf courses in the state of Connecticut do take advantage of these early order program. And for a chemical to be considered a agency product, it has to be, all components that are included in the product have to be identical, including all the inert components. And it also has to be sold to the end user, ourselves or any other golf course or home lawn care company at the set manufacturer's set price. And through this early order program, we're receiving rebates, and you can see on the second sheet, through the 3 different companies we'll be purchasing from the rebates, and then also in-season pricing of the products if we take advantage of the early order.
Okay. Motion on this, then we can have a discussion.
Sure. Move to waive the bidding procedure and purchase chemicals from Harrell's, Winfield, and Bayer companies in the amount not to exceed $65,851, as this is the best interest of the town of Berlin. The chemical purchases are through the early order program of BASF, Syngenta, and Bayer Chemical Companies.
Second on that,
Second.
discussion.
Just a question, Mr. Zook, on this. What's the trend in the sense of, yeah, we get this discount here, but our price is up or down this year?
They're up probably about
Percentage.
1 or 2%
Okay.
from the previous year. Again, even though most of these products, or a good portion of products, are petroleum-based, price of oil obviously has gone down, but the prices of these chemicals have not gone down, as they've actually gone up about 1 or 2%.
Yeah, I think you accounted for that in your budget, and I don't think it was more than 2% or so that we gave on that, so I think you're gonna be fine, right?
Yeah, yes.
Okay.
Okay, any other questions? So all those in favor?
Aye.
Aye.
Opposed? Motion carries.
Thank you.
Thanks. Thanks, John. All right, appointments. I think we had one appointment we mentioned last time, if we can take a nomination for the planning and zoning is the only one that we had. I don't know if we saw anything else in the thing or so.
Okay, I would like to nominate John Michael O'Brien for the planning and zoning opening.
Okay. Do we have any other nominations? Yes.
I'm going to nominate Mr. Edelson again.
Okay, thank you. Any other nominations? Hearing none, so we'll close the nominations and we'll take a vote on.
Counselor
Yes.
Campanelli,
Mr. Edelson?
Counselor Evans,
John Michael O'Brien.
Devin, so. I heard that.
Counselor Letty,
John Michael O'Brien.
Counselor Paynessa,
Mr. O'Brien?
Counselor Rosso.
Me?
Yes,
Yeah.
Rosso.
Edelson.
You're
I'm having
Rosso
trouble with
today.
words today,
Yeah.
I guess. Sorry. Rosso,
Edelson.
thank you. And Mayor Kuzinski,
Mr. O'Brien?
thank you.
All right, so, Mr. O'Brien, welcome to Planning and Zoning, and appreciate your interest in serving on the Planning and Zoning Commission. It'll be interesting, I can tell you that. Yeah, exactly. Okay, where are we at here? Town manager's report.
I have no report.
Okay, thank you. Special committee reports?
Yeah, just, I want to pass out, just get everybody's first,
Calendars.
yeah, it's about the calendar for next coming year. We're not going to vote on it, but just take a look at that one there. And then I have two other preliminary ones. You have to send those back this way, yes.
Oh, send those back, yeah, we need one. That's right. We knew that one.
Want to discuss this one at all? I could. Okay. This one. One of these. That one. And then I have one more. Okay, so the first one is just the regular town council meetings. Pretty much just pick the first and the third Tuesday of every month. There is just a little problem in July, Tuesday, July 4th. So I didn't know when we want to have a council meeting that month. I pushed it to a Wednesday.
I thought we normally did one per month in the summer. Do we do two?
Yeah, we do too.
Okay. On Board of Ed, it's one per month in the summer. That's
Okay.
why I'm asking.
Yep. Just August, we have
Just
no
August.
meetings. We have no
Okay.
meetings.
All right.
The second one is our budget meeting calendar, basically. One says fiscal year 17. I tried to get the actual dates we had meetings. We had a lot meeting, 3 or 4 meetings we didn't meet. I know that last year we pushed it a little bit earlier than normal, so I wanted to get some feedback, or probably Dave, the budget chairman also. I don't know if he's had any discussions with town departments, and I took a guess in the second one. The first Tuesday of the month kind of compresses things, so just want to get some thoughts from everybody, what you think. I can send these out electronically, and that was it.
All right, we'll look at them and see. I mean, the only thing I don't know what to do with it, but the one July 5th, that week,
I don't know
a
what's
lot of
happened in
people
the
are
past.
away,
Our one
right?
last
Huh?
year. We moved
What-
the one
We moved it,
we were
right? I
gonna have
thought.
last
Yeah.
year that day.
Okay, so
People
Stuff wasn't
travel.
here.
right. Maybe we could look at another date for that.
Okay.
Maybe not that week. If we can fit it in somehow. I don't know. What's that?
Are there more of these up there?
Should be.
Preliminary 12-6.
What's going on?
Yes.
Oh, there's a bee?
Yeah.
Lucky him, he's inside. He's all right for a while.
He's got his timing.
Thank you.
Yeah, he's off a
I have
little.
the pens in the car.
Hope he's not angry right now.
So we have Kate till the end of January to get the
Yes.
Yeah,
schedule?
can we,
And what normally would happen is that people will give you feedback at this point, tell you what dates, like if July 5th is a bad date. And you can always move it out
Sure.
to the next week or move it out a little bit. And move that next one to the last meeting in July. I think we've done that before.
Okay.
And then we can put it on the agenda. I'll do the summary item for you to put it on the agenda for December 20th. And if there's problems, you can always move it to the first meeting in January.
Sure.
But the sooner the better, especially for Nutmeg. Nutmeg needs to start doing their scheduling. So if we can get it into them, that would be great.
Okay.
all right, yeah, we'll look at it, and I'm sure we'll have some comments, at the next meeting. We're gonna
That
finalize
was
it.
it from me.
That's it for that. Any other special meetings, committee meetings? No, hearing none. All right, we'll go on to Counselor Communications. what do we have? Any talk about anything? Yes.
So a couple things. First thing, on December 1st, I did go to that lean presentation. They did give out handouts, and they are going to email everything to us once, I guess they've gotten it all uploaded, so that'll be excellent. It was really wonderful. What I've learned through my lean participation is that lean is a collaborative effort. So it's, everybody gets involved, everybody gets their hands on the process, right down to the, people who are on the front lines. So everybody takes ownership of the process and wants to make it better. So I think that's really awesome, and I hope that that's something we could make work here. I think it could save us money, I think it could make our government leaner, and I really do think it's a good thing for our town.
All right, great.
Deliver a better end product to our citizens. So once I get that information, I will share it with everybody. And there is, I think, what they ended up saying is next steps were sort of, get people on board, see who's excited about it, and, try and figure out that going forward. People need to learn about lean, so they have these consultants, and I guess there's a list of them who are state consultants. I believe the cost is $1,500 for a session with the consultant. They explain how to do it, and then you take it and do it yourself. So we would be doing it here. So I think it was 3 hours with this consultant who tells us sort of how we need to do it and whatnot. And I'll send all that information to everybody once I get that too. So there's that. The next thing was on January 11th, 2017, a friend of mine and I and a committee of folks are going to be hosting a drug forum for the town of Berlin. There's going to be participants from the police department, Board of Education, several others. It's going to be at the Berlin High School auditorium, 6:30 to 8:30 p.m. And it's going to be about substance abuse and opioids and sort of how that affects our community. And I think Mr. Brown is going to be one of the participants, so it's going to be a very informative evening and helpful to all of us in learning what we can do to resolve that issue. So January 11th, 2017. It's a Wednesday night, I think, Berlin High School auditorium. So it'll be nice to get in there and see the new auditorium too. I do know that there's plans to have vendors set up outside, so there will be lots and lots of information. I know the insurance department has indicated they will participate, so they'll have information there for folks with questions on insurance coverage for treatment and things like that. I know that there's going to be reach out to some of the providers who do rehabilitation and stuff like that, so there'll be people there with some information on that as well, so it'll be a very good event.
And who's that with?
It's the Berlin Substance Abuse Council Coalition, I believe is the name. I can't remember exactly off the top of my head, but it's a community group, basically.
Are they part of the Capital Area Substance Abuse Council? Because I used to be the chairman of that, but so they're a different.
This is grassroots. It's a friend of mine.
Oh, okay.
Some friends and family members of hers. We're working with the Commissioner of Public Health, Commissioner of Mental Health and Addiction Services, the Central Connecticut Health District, our social services, Doug Truitt, our police department, our Board of Education. So.
Good. All right. Yeah.
Will there be a cost associated to the town for janitor service? Will the police require policemen to be there and all of that?
No, it's they're not going to be required to be there. They're going to be participating in the forum.
Basketball game or anything else, they require all these fees. Do we need to waive that?
I asked, and when I filled out the form, she said the fees will be waived. So I said, okay, great, thank you. So I'm not going to look a gift horse in the mouth, that's for sure.
All right. Good. What else? Any other? Yes, Dave.
Just to add to the lean, some of us have been involved in lean manufacturing with respect to the manufacturing, but it also spills over into the services, and it's exactly where this needs to fit. Top management, council, as well as town manager and others have to understand it and drive that. That's where that comes from, for adoption of that throughout, and it's simple reduction of labor and effort over the long term. Also, the high school annually has an opiate program. They just recently finished that up this past month, and they brought in very poignant speakers for that. So it's an effective need that we have in our town, so I'm supportive of such things.
Great. Good. Okay, anything else? We good? Excuse me? Okay, so acceptance of minutes, if we could have a motion for the
Okay.
October 13th.
Motion to accept the special town council meeting minutes from Thursday, October 13th.
Second on that?
Second.
Those in favor?
Aye.
Opposed? Motion carries, and
Motion to accept the town council meeting minutes from November 15th, 2016.
second.
Second on that.
Those in favor?
Aye.
Thank you. All right, so now we need to make a motion to move into our executive session.
Okay.
And
Who's staying in?
and invite, if we could invite those people.
Okay,
into our
I
executive
will make a motion to move into executive session for the discussion of real estate, discussion of the site, sale or purchase of real estate by the town, 727 Worthington Ridge, and invite in the town council, Denise McNair, the town manager, Jeff, and Helen.
Okay. Second on that?
Second.
All those in favor?
Aye.